Master of Science in Physiology, University of the Philippines, Chairman of the Department of ENT, Head and Neck Surgery, Vicente Soto Medical Center, Cebu City, Chairman of the Department of ENT, Southwestern University, and a practitioner of biologics and integrative medicine. Please welcome Dr. Felicidad Felicilda.
It's indeed a privilege that I will be able to come here in sa Cebu. Professor Flora Calleja, nagtanong sa akin dahil bakit daw yung pangalan ko ang babae. Dahil yung pangalan ko naman talaga Felicidad. At, when I was training in reconstructive surgery when I was in US, gusto kong palitan yung pangalan ko. Dahil pampakla Felicidad, Felicilda. Pero may mga kaibigan mo ako na nagpalit ng pangalan nila, in-English nila dahil gusto nga nilang maganda-ganda yung pangalan. Example, yung isang kaibigan ko, yung pangalan niya, Casimiro Bukakir. Ito naman yung pangalan. Pinalitan, naging English, naging Casmer Buke. Yung isa naman Tusipiro Fructoso. Pinalitan, naging Tutti Frutti. Pero yung isang babae, magaling, pinalitan niya, Juliana Bubuyong, naging Jollibee. Dito naman sa Cebu, meron akong kaibigan dito na ang misis niya ay veterinarian. Siya ay ENT tulad ko. Diplomito siya sa Philippine College of Surgeon. Isang araw, may nagtawag sa kanya ng telephone na please may I talk to Dr. Vicente. Dr. Vicente yung pangalan niya. May I talk to Dr. Vicente. Ang nakasagot ko yung katulong na, sino ang Dr. Vicente ang gusto mong kausap? Ang doktor ng hayop o ang hayop na doktor? Okay, gano'n naman. Seryoso kayo masyado kaya ako pinapatawa ko kayo. I was enjoying the lecture of Professor Flora Calleja kanina, and I was looking at that particular thing that is a Felix buried alive never dies. This is not my lecture yet, but I just would like to comment on such a thing because I am dealing with a lot of cancer patients. And every cancer patient that I see in my clinic, I feel obliged to counsel. I feel obliged to counsel. Now, I just would like to say this probably in summary because I feel that all these things are actually buried in the Bible. The Bible says, it is not from without that defiles a man, but from within. Because out of the heart comes hatred, jealousy, adultery, fornication, and all other bad emotions. And these are the things that defiles a man. These are the things that defiles a man. So every time that I look at a patient, I tell them, whatsoever things are true, whatsoever things are honest, whatsoever things are just, whatsoever things are a good report, think of these things. These are things that are actually being said in the Bible. The Bible also says, present your body as a living sacrifice, holy and acceptable to God, which is your reasonable service. And be ye not conformed to this world, but be ye transformed by the renewing of your mind, so that you will know what is the good, acceptable, and perfect will of God in your life. So I will ask my patient, is it good that you have a cancer? No. Is it acceptable? No. Is it perfect? No. Then, why do you have to conform? It is not good, it is not acceptable, it is not perfect. You are not supposed to conform. Because there are things that will come into your life, you say, sakit sa katawan ko. But most of us conform to it. The Bible says, you have to transform. But how do you transform? By the renewing of your mind. And that's the reason why whatsoever things are true, whatsoever things are good, whatsoever things are just, whatsoever things are a good report, think of these things. Think of these things. My topic actually is gatungan. Probably you will be interested why I got hold of this Tian Xian, Tian Xian. I just would like to give you a short history how I was able to learn about Tian Xian. I was actually I am a practitioner by profession. I am a head and neck surgeon. And I do a lot of head and neck surgery. One of the cases that I will show you is just like this. These are things that I am doing. This is one particular patient. Probably you will not be able to see this far, but these are things that I am doing as a surgeon. So this is a case of adenocarcinoma on the left maxillary area. And as you can see, this is a really quite a big tumor. And these are the thing that I am doing in terms of surgery. As you can see, I was not able to scan this, but I was able to operate and manage this case 3 months ago. Okay? So you can see that this is one of the cases that I am doing. Mostly, and oftentimes, if you can see this case, ang ginagawa ko namin, binabakbak ko ang mukha. That means I have to remove everything, including the bones, including the palatal bone, including the eye. During the time that I was training in surgery here in Manila, I was training at Jose Reyes Medical Center. Ako ang magaling mag-inganyo ng mga pasyenteng magpa-opera. Dahil sasabihin ko yun, mayroong ganyan. Mister, kailangan operahan ka. Ang gagawin ko, babakbakin ko ang mukha mo, tanggalin ko yung mata mo. Ganyan. And one particular patient actually really succumbed to surgery. And this for that particular reason, that particular patient, we did a maxillectomy or total maxillectomy with orbital exenteration. Yung orbital exenteration, tinatanggal mo ang lahat ng mata mo. Dito, natanggalin mo gano'n. Tapos yung maxillectomy, tatanggalin mo dito. Ang gagawin, tatanggalin dito. At yung palatal bone. What I do actually is to cover it with a deltopectoral plaque, just like this. So, in this particular case, hindi ko tinanggal ang buto. Because binigyan ko ito ng Tian Xian. You can see na tinanggal ko yung tumor. But at the same time, linagyan ko siya ng plaque dito. Tatanggalin mo ang skin dito at ilalagay mo natin sa mukha para naman maging guwapo. Ganyan. Yan ang nangyari. So, ang pasyente ay ganyan ang nangyari. Dito tinanggal at nilagay natin sa mukha. Dahil binakbak ko natin yung tumor dito. After 3 weeks, ang gagawin natin, puputulin natin dyan at ikatahin natin, ganito na ang pasyente katapos. So you will notice wala na mong tumor. But that particular patient is still taking Tian Xian. Now, why do I say these things? Dahil sa experience ko ng pasyente na when I was still first year resident, ang nangyari, tinanggal namin lahat. Tinanggal ko yung mata, deltopectoral plaque, successful ang operation. Tanggal mo ang tumor. Pero, the patient died. Hindi mo namatay siya sa operasyon, namatay yung pasyente ko sa konsumisyon. Dahil nag-tumingin siya sa mukha niya, naku sabi niya, Doctor, you cannot face your problem if the problem is your face. So, you cannot face your problem if the problem is... Dahil, para ko siya legal shatter. Ang nakakasama ka mo, hindi doon malapit yung asawa niya, hindi natatakot yung asawa niya. Ang yung initiating part, nag-6th floor yun. One day, maganda yung healing niya. Pumunta siya sa bintana, lumaso. Siyempre, patay. Since then, I did not do any maxillectomy surgery anymore. Hindi ho ako gumagawa ng maxillectomy dahil alam ko kung ano ang healing ng isang tao, binabakbak ko ang mukha. So I studied more on reconstructive surgery so that I may be able to reconstruct. No? And then I studied more also on areas wherein I may probably be able to do to heal a patient without surgery. And that's the reason why I was able to get this Tian Xian. I was able to read the book. But what interested me from the book actually was a writing from the back. And that writing there is, how can a person be saved? If you believe in Jesus Christ. It interested me. So I read on that aspect, and I read the book. But the first thing that interests me is that particular statement on how you will be saved, before I was able to read the book. So I will give you an experience that I have on Tian Xian as a supplementary therapy of radiotherapy. Okay? I will be presenting to you a case of an 84-year-old woman with squamous cell carcinoma, left nostril. My specialty is ear, nose, and throat, head and neck surgery, and I am dealing with a lot of tumors on the head and neck area. The reason why I became a head and neck surgeon is because yung misis ko, ayaw mo niyang umawak ako ng paganito. Dito lang daw. Nandun na yung misis ko. So, this is a case of a squamous cell carcinoma, lymph node stress, treated with Tian Xian liquid, Tian Xian capsule number 3, and radiotherapy. So, I am presenting this to you. There was a rapid regression of the mass size with no apparent side effects of radiotherapy noted on this patient. You know, kung alam niyo ang radiotherapy, the use of radiotherapy in the treatment of malignant lesion is usually accompanied with several side effects like erythema, dryness, mild discoloration of the skin, serous otitis media, mucositis, olinupagia, and serothalmia. The acute side effects of radiotherapy becomes manifest within the second week and third week of treatment, and it resolves within 4 to 6 weeks after completing radiotherapy. Now, its effect on the lesion is oftentimes not dramatic. That's the reason why we usually do surgery before we will actually subject the patient for radiotherapy. Okay? So, radiotherapy involves the use of various forms of ionizing radiations to treat benign or malignant lesions. Ionizing radiation causes damage to the DNA and the target cells through complicated series of anatomic reactions. Most of the nuclear damage is due to the interaction of DNA with free radicals, which are formed by the interaction of the radiation with water molecules. Next slide. Okay. Following radiotherapy, damaged cells undergo mitotic death in both abnormal and normal cells involved, thus causing side effects and complications. So I am reporting this case to show the possibility of increasing the effect of radiotherapy without the usual complications noted. So, this is an 84-year-old woman. Notice that there is a mass on the left nostril. She sought consultation because of nasal obstruction. Nagdudugo ho yung ilong niya on the left nostrils 1 month prior to consult. So, what we did is to do anterior rhinoscopy. In-examine mo natin ang ilong, and it showed a polypoid ulcerated mass left nostrils attached to the ethmoid area. Next slide. Okay. X-ray paranasal sinuses showed haziness of the left maxillary sinuses and ethmoid sinuses without bone destruction. So we did a histopathology pans biopsy here. Pans biopsy was done on the mass, and histopathology report showed squamous cell carcinoma moderately differentiated. Patient was prepared for surgery, but CT clearance was not granted because ECG showed that there was myocardial ischemia in this patient. So what I did was to refer the patient to Tian Xian Cancer Center for radiotherapy. Radiotherapy was started daily. At the same time, I was able to give this patient Tian Xian capsule number 3, 2 capsules 3 times a day, Tian Xian liquid 1 vial 3 times a day, and patient was followed up 2 times a week at the clinic for evaluation of the mass and side effects of radiotherapy. Regression of the mass size was noted 2 weeks after radiotherapy with no apparent side effects. On the 3rd week, the mass was gone. Next slide. You will notice that there was no more mass there. 3rd week, the mass was gone, and on the 4th week, radiotherapy was finished without any side effects of radiotherapy. It is uncommon that there is no side effects on radiotherapy. But I was looking at the combination of Tian Xian and radiotherapy in this 84-year-old woman, which showed a dramatic regression of the mass with no apparent side effects. Is this coincidence? Or is it because of the supplementary effects of Tian Xian with radiotherapy? The anti-carcinogenic substance of Tian Xian is still unknown. Right now, I am still studying Tian Xian actually. However, in 1968, I was looking at different journals. The results of animal experiments show that hot water extracts prepared from fruiting bodies of some edible fungi and plants of the family Polyporacea, Philonacea, and Campanulacea had recognizable anti-tumor effect on sarcoma. Next slide. Next slide. Nahuli yung misis ko. Okay? Next slide, please. Next slide. Sinasabi tayo yung lecture. Oh, back. Nawala na. Okay, see? Please na. Okay. Campanulacea family is a relative of radix, which is one of the component of Tian Xian capsule number 3. And the component of that, or the responsible for that, is HB-glucans and polysaccharide form D-glucostroacidhydrolysis. This is the molecular formula of that. In a research by Whistler et al. Entitled Non-Cytotoxic Anti-Tumor Polysaccharide, it showed that there is an anti-carcinogenic mechanism of beta-glucans. But there are no difference from the other immunomodulators that activate specific immunologic functions in the patient. So, I looked at the contents of Tian Xian, and you will notice that there are a lot of amino acids, there are a lot of minerals that are present in Tian Xian. The Tian Xian liquid contains ginseng soups and other elements, amino acids, several kinds of essential elements like germanium, selenium, zinc, manganese, and all this can stimulate the anti-carcinogenic functions of phagocytes. Now, in Tian Xian, the composition of selenium is 500 times more effective for antioxidation of vitamin E and can promote rapid absorption and utilization of vitamin A, C, E, and K. Now, since there is a lot of selenium which can promote the absorption or rapid absorption of A, C, E, and K, Tian Xian therefore promotes optimal collagen production because the rapid absorption and utilization of vitamin C, which is important, which is a very important nutrient in collagen production, will be able to result in optimal production of collagen molecules. This is a precondition for control of aggressive diseases like cancer. Next slide. Now, the other substances required for collagen production is lysine and proline. This is also present in high amount in Tian Xian. Next slide, please. Now, in a study by Astin et al., Journal of American Medical Association, July 11, 1977, it presented spectacular successes in the treatment of ovarian tumor using the enzyme blocking therapy. In this particular enzyme blocking therapy, the patients were just merely treated with tranexamic acid. And tranexamic acid is hemostat, cyclocapron. These are synthetic derivative of natural amino acid lysine. And you know, if you use a lot of amount of lysine, it will mimic the effect of tranexamic acid without any side effect. Next slide, please. Why? Because lysine blocks the anchor sites in the connective tissue that collagen digesting enzyme used to attach, thus preventing disintegration of connective tissue. You know, in cancer, the reason why cancer cells metastasize or spread is because there are collagen digesting enzymes that will attach to the oncocytes. When the collagen digesting enzyme will attach to the oncocyte, what will happen is that the small cancer cells will go out. This is also the same effect on phagocytosis or the chemotactic effect of white blood cells. Bakit yung white blood cells lumalabas? For example, mayroon kang pigsa dito. Supposed to be yung white blood cells nandoon sa dugo, doon sa artery lang. Bakit pumupunta yung white blood cells mo doon? Because there will be some collagen digesting enzyme or the chemotactic factor attaching on those areas at yung white blood cells mo lumalabas in order that it will be able to attack that particular area. Similar effect is affecting also in cancer. Collagen digesting enzyme will be present there on the oncocyte. Kaya lumalabas ho yung cancer cell, it will spread. And lysine will block the oncocytes in the connective tissue that collagen digesting enzyme used to attach. So it will prevent the disintegration of connective tissue. Next slide. Now, one thing good with lysine is also it is a precursor of carnitine, which is very important for energy metabolism. It will have an effect on mitochondria and it will actually cause energy metabolism. Next slide, please. Now, I combine radiotherapy with Tian Xian. The ionizing radiation of radiotherapy causes damage to the DNA of the cancer cells. Okay? Next slide. While at the same time I give Tian Xian capsule number 3. So Tian Xian capsule number 3 contains beta-glucans which activate the immunologic functions in the patient. So there is a synergistic effect. You are trying to activate the immunomodulators in the patient and at the same time you destroy the cancer cells. Next slide. There are also substances that are present in your Tian Xian liquid which is lysine, vitamin C folate, which promote optimal production of collagen molecule which is very important in the control of cancer. Next slide. Now, I concluded that radiotherapy plus Tian Xian effect causes rapid regression of tumors. As you will notice, for just nearly 3 weeks, there was already, the mass was gone. Lysine, which is the basic building block of carnitine, causes an increase in energy metabolism, resulting to rapid repair of normal cells. You see, radiotherapy will not only attack the cancer cells, it will at the same time attack the normal cells. But one thing good is that lysine is the precursor of carnitine, which also will have a rapid metabolism on the normal cells, causing its repair. So in effect, this will be the summary that I will have to tell you, and I would just like to answer your questions later on. The effects of radiotherapy in cancer treatment is complemented by Tian Xian in the following areas. Number 1, Tian Xian has an anti-carcinogenic property. Its effect is just like an immunomodulator that activates specific immunologic function in the patient. Number 2, Tian Xian prevents the disintegration of connective tissue, thus preventing the spread of tumors. Number 3, Tian Xian promotes optimal production of collagen molecules, which is a precondition for the control of cancer. Number 4, Tian Xian improves energy metabolism, causing rapid repair of normal cells, preventing side effects of radiotherapy. Next. Other Tian Xian effects are still to be investigated, and therefore more researches should be done. And I would like to thank you for listening to me. Thank you so much.